Hi everybody, lovely to see you all here today. My name's Merina Martin. I am the Homecare Champion at CareLineLive. My background is domiciliary care. I've been an agency owner, nominated individual, registered manager. I'm very interested in business development and business turnaround. I've worked extensively in the startup market. And I've also worked in the tech industry on and off for quite a few years now as well. In terms of what a home care champion does, well, I've got a lovely job that I very much enjoy. So what I do is I'm looking at industry changes, anything that's happening that's new, or things like the single assessment framework, trying to get to the bottom of that, and any other areas of interest. I also write a lot of blogs, and we have a lot of information, actually, just talking about blogs, on the single assessment framework on our website, www.carelinelive.com. If you go to the blogs, we've got information on all of the key questions, quality statements and evidence categories, and that gives you information about the types of evidence you can collect. I just wanted to say that before I forget. So there's lots of information on our website. I also write other articles. I attend trade shows, see what's going on with other companies and other services within the industry, and obviously I do webinars as well. So the point of today's webinar is just because we really feel that there's a lot of uncertainty with providers about the new single assessment framework, and people are unsure of the requirements, how it's going to work. There is quite a lot of information on the CQC website, but actually there's so much, it's quite confusing. And I did talk to CQC extensively at the Excel at the Care Show last week, and I don't really think that they're that clear on what's going on either. So I think the powers that be sort of know what's going on, but certainly some of the people that I spoke to on the CQC stand were quite unsure. So in terms of the new assessment framework, I personally think it's a good way forward, and I think there's been a lot of historic issues for providers and for CQC actually. And if we look at the ratings, there's been a lot of inflexibility about ratings, and services stuck with ratings for long periods of time. And I have an excellent example of that. My mum's in a care home, and I had to fight to get her in there, although the care home is requiring improvement, but it was meeting all of her needs, her spiritual needs, her cultural needs, and it's fantastic. Obviously my mum wouldn't be there if it wasn't fantastic, and they've sat with a rating of requires improvement for almost 4 years, and we all know that that just can't continue to happen. It's not fair. It's not fair on the service users, it's not fair on the people working in the services, and actually it's quite demoralizing if you're working in a service that requires improvement. So I think CQC have obviously recognised that that can't continue. And also there's discrepancies in the way rating decisions are made. There's not very much transparency in the way decisions are made about the ratings. And also from a provider perspective, there's very little opportunity to showcase improvement unless you're inadequate or requiring improvement. But there isn't that opportunity to show off what you're doing, basically. So that's sort of the control of that's been taken off providers, and I'm very much hoping that the case will be very different now. You'll be able to showcase the amazing work that you're doing. I think in terms of the way inspections have been held and the sort of information that they've wanted has been very inflexible, and I think they've certainly had a one-size-fits-all approach, and actually a lack of objectivity about thinking outside the box. And I think especially since the pandemic, we've all realised that we have to work in different ways. People are becoming very innovative about how they're recruiting, etc. And CQC need to sort of step up their pace and stay with that. I think in terms of inspection and registration, I'm just going to talk a little bit about registration now, because I spoke to CQC about registration last week. And I was trying to sort of get information from them about transparency in timescales, right across the board. You know, so when you send a document, when should you expect an answer? When you register, you know, how long will it take? Because there isn't very much transparency around that. So just a little bit about registration now. We're going off topic just slightly. I just want to say that there are backlogs with registration, and I spoke to 2 people from that department at CQC, and they said that they're looking at registrations from October 23, so they are way behind. They've also got a backlog of 7,000. And they're obviously getting registrations coming in every day. And they said to me that they can handle 3,000 registrations a month. So they are way behind. They're working towards, you know, bridging that gap and sort of getting up to date with stuff. But they didn't seem that optimistic. So I think timescales and the transparency around timescales is very, very sketchy. And looking at inspection, you know, inspection timeframes, as I've said about my my example that I gave you, you know, waiting up to 4 years for a re-inspection is just ridiculous. You know, that can't be allowed to continue. I think also support in the past, I personally found it very good, especially if I've been working with a service that has a few problems, but I found the support quite generic, and also there hasn't been, you know, enough people to help with specific issues and problems. And I think in terms of communication, as I've said before, you know, you've got the delays in the response times. You haven't got any. We don't have clear guidelines as to timeframes. What I have found is that my experience is that I haven't actually had a key point of contact unless I've been in a dire situation with a service. And I think that I know that some services do have a direct point of contact with an inspector, but that has not been my personal experience. And also my personal experience has been unavailability to speak to an inspector in a timely manner. And it just doesn't help to build relationships with CQC or, you know, your wider partners. You need that communication. You know, you need to have strong relationships. I was going to say I can't look at and talk about the IT without smiling, because we've had such headaches with the new provider portal. I have been assured that that is fine now. I don't know what everybody's experiences are. It'd be interesting to know. But, you know, the outdated IT has caused, you know, long, laborious processes and duplication of information. We've all known what it's like when you're registering a service or registering a manager, whatever it might be. You're repeating information constantly. So hopefully the new portal will help with that. So that's the historical issue. So if we go on to what the aims of the change are. CQC have assured me that they are trying to work more agile, in a more agile way, and be much more responsive to in the ways that they're working. And they're very, very interested in getting a really good, firm understanding locally about people and communities. In terms of how they inspect, they want much smarter regulation. They just want to step up the pace with that. And they want to see services being a lot safer and safer through learnings. So what you're documenting, you know, what your issues are, they want to see that safety is being improved by those learnings. And, you know, that's going to accelerate the improvement. They also want people using services, or anybody that has anything to do with services, they want to give those people a voice. So people that have experiences of using services, partners, staff, etc., that they want to hear what they've got to say. And they definitely want to tackle the inequalities in healthcare that we're facing constantly. In terms of changes, they really do want to have a good view of the state of the current service, where services are, where they're trying to improve, etc. And, you know, when I spoke to them last week, they definitely want to make sure that they've got some transparency and consistency in the way that they're inspecting and assessing services. And I think part of the framework, the major part of the framework, is that they can see that continual assessment, and that's going to help with services being more compliant to the regulations, fundamental standards, etc., and also to facilitate improvement and services learning. So they're really very, very keen to see that sort of journey, that constant journey with services. And of course, as we've said, they do not want services to be stuck with ratings for long periods of time. That's not good for anybody. So let's just look at CQC and see what's happening with them. Well, when I spoke to them last week, I already understood from the communications and the webinars that I've attended that there's so much organisational change with CQC. And so I just want to give you a little overview of what the changes are looking like for them. And when I did speak to them last week, they were quite nervous, and the people I spoke to were quite nervous and anxious about the huge amount of change they're going through. So I think we do have to have a little bit of sympathy, even though we're sort of quite irritated in some ways with the way things are going. I think, you know, a little bit of sympathy on where they are as an organisation is helpful. So they're going to be split up into geographical regions. There'll be a North, South, Midlands, London and the South East. And there will be specialist teams, which I think is really good news. So there'll be adult social care, there'll be hospital, primary medical services and specialist sector teams. So, for example, for home care, domiciliary care, we will have specialists in that area, which can only be a good thing because they'll understand, you know, the trials and tribulations and challenges that are faced by people running home care services. So all those specialist teams, there will also be localised teams. So in our local area, so say in the north, I'm in the north, so I'll use that as an example. There will be inspectors within that localised team. So they will be looking at the risks, enforcing regulation, factual accuracy checks of the information that you're giving them. They will be checking that, double checking it, getting in contact with you if they need more information. There'll be assessors. They will be reviewing a lot of the data, and any issues that they have will go to the inspectors. They will not be doing any off-site inspections or anything. The assessors will be purely reviewing the data. There'll be regulatory coordinators who will generally look at any queries or information that you need. They'll be doing sort of general admin, everyday stuff. And overseeing all of that, there will be operations managers. So I think that seems quite structured. In terms of what's changing and what's not changing, so spoke to CQC last week, and I keep saying that, but I was trying to get as much information for you as possible that was absolutely up to date. So you provide an information return, is an annual return that everybody will need to complete annually. So I would say keep that up to date. CQC will not, if you're contacted for your annual provider information return, that does not mean to say that you have got an imminent inspection. They made that very clear to me. Everybody will be doing that. It's very much like the Scottish Inspectorate and the Welsh Inspectorate. That's what they do. They both have an annual return. The fundamental standards are the same, and the regulations. I did ask CQC about best practice, but they weren't very forthcoming with the information that I wanted. I did this same webinar a couple of weeks ago, and we were talking about writing care plans in the first person. CQC said to me that they didn't have any guidance on that, and that we should go to sources like Age UK. I wasn't quite sure whether Age UK was the right type of resource to go to get that sort of information. But what CQC was saying to me was you just need to find out what best practice is at that time. So I would say, you know, if you're looking at best practice, do what you normally do, CQC guidance, your local authority guidance, skills for care, SCI, you know, social Healthcare Institute for Excellence, any of those renowned sources of information, I would say go to them. So that was a little bit disappointing. I was hoping that we would get more information on, you know, how they see best practice. Anyway, that wasn't to be. So going on to the provider portal. So we know what we can do at the moment. We can do registration. So any new services or new registered managers, etc., you can register through the provider portal, and you will supply supporting documents. When a service has been successful through that process, they will start with a rating of good. So again, I spoke to CQC about the interview for registration with them. They said that you need full knowledge of the key questions, the quality statements, and the evidence categories. So you really need to be very much in touch and knowledgeable about the new single assessment framework. Also on the portal, currently you can make amendments to your registration and also make some statutory notifications. Eventually, you will be submitting evidence for analysis and assessment through the provider portal, and you will get a monthly download report which you will be able to check for factual accuracy. And in that report, you will see where you are with your rating for each key question. So the CQC will be emailing the nominated individual and registered manager when they are going to start assessing in your area. That's key information that they gave me last week. In terms of inspections, CQC are currently focusing on services that have ratings of inadequate or require improvement, and they are focusing on the key questions and the quality statements in the categories that you have been rated requiring improvement. So, you know, if you require improvement in SAFE, they will be focusing on those key questions. They will also come out to inspect when there's a clear need to do so. So if the service has a lot of complaints, there is a lot of risks, safeguarding issues, if they're really unhappy with the information that they've got, they will come out and inspect. They will also come out and inspect when there's limited information available. So if you're not using technology or you're not proficient with using technology, it's something that you really need to sort of look at and think about, because you are going to be using the new provider portal. It's digital technology. You really need to be able to upload your information on there and receive feedback from, you know, your monthly download report. So, you know, it's very, very important that, you know, you make sure that if you don't want CQC to come out to inspect, you need to be engaging with them and giving them the information that they are requesting. There are also some services that they will always inspect. They've said that categorically, if they feel that that service needs a face-to-face inspection ongoing, that's what they will do. I don't think that's particularly relevant to home care, but yes, there will be some services that they will always inspect in person. So what have we got? How's the structure changing? What's the new single assessment framework going to look like? So I'm going to, it's a little bit confusing for people. So we're going to still have the Chloes. They're not called the Chloes now. They're called key questions. So forget Chloe, forget key lines of inquiry. They are now going to be called the key questions. So we're still going to be assessed on safe, caring, effective, responsive, and well led. Okay, underpinning those key questions, we will have quality statements. And then for each key question and quality statements, there will be specific evidence criteria that you need to provide evidence for. Just talking about the quality statements, I'm going to go through an example of a quality statement just in a few minutes. But just to give you an outline of where we are with quality statements, we're going to have 34 quality statements, which is a vast improvement on the 300 and odd sub-questions that we've previously had with CareLine's inquiry. They give guidance of what CQC expects. They give the standards of care that people using services should expect. And the quality statements that they will select will depend on your service type, excuse me, and what they call national priority. So an example of national priority could be that lots of home care services in the northern region have got safety issues. So they would definitely be looking at the quality statements under the key question of safe. So they'll be using that information and information that you've uploaded, information that they hold about your service. Now, the quality statements I think are very good, and they're written as we statements. So it's what we will do as providers to provide good care. I statements are what I, as a service user, can expect from a care service. So we've got the we statements, which are the service provider, and the I statements that are people using services. Now, the evidence categories are really important. So under each quality statement, CQC will be asking for a variety of evidence, and it's absolutely critical that you collect a lot of feedback and information about people's experiences. So feedback from your clients, feedback from staff and leaders, and feedback from partners. Now, you not only do CQC want feedback, they want to know how you are using that feedback for safety, for improving your service, for developing your service. So they want evidence of what has been done with that information. This is all about service improvement, service safety. They're very, very keen to see that feedback. They want to know that you've got absolutely robust policies and processes in place, and that they are updated as and when they need to be updated, and that they are used correctly. They want to know about the outcomes of care. Are people living the healthiest, most independent lives that they can? Are the outcomes realistic? You know, whatever it might be. I know you all know about, you know, outcomes of care. And observations. Now, the observation evidence category does apply, in my mind, to home care. What CQC is saying is that they won't be observing care in people's homes. If I was managing a service now, I would still be doing observations of care, because you do that anyway when you're doing things like your carer spot checks, and I would be collating that evidence. I'm sure you have forms that you fill in, etc., etc. So I'd be collating that evidence, and I would be providing evidence in that category. I think it's a really good way of getting in the habit of just meeting all of this evidence criteria. So the type of evidence that CQC are going to ask of the variety of services across health and social care is very much dependent on the type of service, and you know, the level of assessment is going to be different. So for a local authority, the evidence that they're going to ask for is going to be very different from a small domiciliary care service. And existing services will be asked for different information than services that are registering, which can only be a good thing as well, because I can remember when I first started in domiciliary care, you know, you'd be providing reams and reams of information that you know, massive organisations were having to provide as well, and it just didn't seem sort of to balance out really. So that you know, that's going to be really good, that you know, they're very much more targeted in their approach to what information that they're going to ask for, dependent on the situation. So in terms of ratings, this is still a little bit sketchy. So this is what we believe is going to happen now. So under each key question, you've got your quality statements, And for each quality statement or the quality statements that CQC decide they're going to look at, they will be scoring you. And for each part of your evidence category, you can score a maximum of 4, which would give you a maximum of 24 for each quality statement. And what will happen is that information from the quality statements will be calculated into percentages, and that will give you your rating. Now, the good thing about the ratings is, and about your monthly download report, you will be able to see where you are within the rating bands for each of the quality questions, the key questions, sorry. And then so you'll be able to see, say, under safe, whether you're at the top end of good, in the middle of good, or getting towards requiring improvement in good. And the same for caring, responsive, effective and well led. So the rating bands will be, if you're outstanding, you will have scored a percentage of over 87%. If you're good, your scoring will be 63 to 87%. Requires improvement 39 to 62%, and inadequate will be 25 to 38%. So I think it'll be good to just see where you are, and it'll just really give you a lovely visual as to how you can improve your service. I'm hoping it'll give you a visual. I do believe that is the plan. So we're going to have a look at the quality statement of or the quality statements under the key question of safe. So when you look, if you go to CQC onto their website, you will see that you can see the quality statements under each question. They very kindly give you the regulations that relate to each quality statement. And under the key question of safe, the quality statements are about learning culture, safe systems, pathways and transitions, safeguarding, involving people to manage risk, safe environments, safe and effective staffing, infection prevention and control, and medicines optimization. So they're your 8 quality statements. We're going to look at the quality statement of learning culture. So that quality statement is, we have a proactive and positive culture of safety based on openness and honesty, in which concerns about safety are listened to, safety events are investigated and reported thoroughly, and lessons are learned to continually identify and embed good practice. That is very self-explanatory in my mind. What I'd be saying to myself as a manager is, right, okay, when we have concerns, incidents, risks, I would be a CareLineLive user, obviously. So I would go to my concern and incident reporting feature, and I would add in all of the information that we would need. So you'd be taking information on what happened, who was involved, what statutory notifications have been made, have the local authority been contacted, is there a formal investigation, what are the timescales, who's in charge of that whole investigation. And when we developed this actual feature, you can actually document how you've met each key question. So you can say what you did under safe, effective, responsive, well-led, etc. And also you can talk about the lessons learned as well. So you've got absolute proof that you can upload, you can download as a report, you can upload it to CQC, and they have got all of the information they need on how you are managing safety and risk and how you are improving your service to meet the key questions and quality statements. As you can see, we've got like a little screen on this slide. I just want to reiterate what we said before, what I said before, sorry, at the beginning, that we've got lots of information about the single assessment framework on the on our website, www.carelinelive.com. If you go on there, we've got everything you need, little bits of information, and each of the assessment framework key question pieces has got the key questions, the quality statements and types of evidence you can collect. So it just gives you a little bit of an idea of, obviously you're going to collect the information that you need for your specific service, but gives you an idea, and I've really run through and drilled down on them. So please do have a look at them. The next slide is about MOA. Now, MOA benchmarking is one of our partners that we work with, and I just wanted to show you this screen because I'm hoping that the visual that you get from CQC for your monthly download report will look like this. So you'll be able to see where you are in your percentage and where you meet those key questions. If you haven't looked at MOA benchmarking, do have a look at it. It's specific to CQC and it's a benchmarking software. So you can see where you sit with different companies, the home care companies, just in England, because it is just specifically for CQC. The other good thing about it is that you can do plans for improvement. It's got a lot of auditing, different to the auditing that we have on CareLineLive, but it gives you an opportunity to do your business or your service improvement on there. So do take a look. They're a great partner. I think it's a fantastic system. So yeah, it's great to work in conjunction with CareLineLive with that. So I just wanted to give you a bit of key advice that I've really thought about, and just wanted to think about how you can make the most of trying to be prepared for the new single assessment framework. And I think it's really, really important to educate your staff about the new framework. I think we don't, I can't speak for you, but in the past, I think there hasn't been enough emphasis when you're doing, say, inductions, or when I was doing inductions, about CQC, the fundamental standards, regulations, responsibilities, or the responsibility that we have when we're a regulated organisation. So I think it's really, really important to just make that very clear, because it is a big transition for everybody. And I think it's not just for carers. I think right across organisations, everybody needs to know about the responsibilities for CQC. The fundamental standards, what people are expecting from care. I know we're doing that in our induction, but it's just sort of hitting it home, really. And do this. You can do this through staff focus groups, single assessment framework. Talk about what W&I statements are and what they mean, the quality statements, the type of evidence that you're going to collect. Because if your staff know what you're looking for, they're more likely to make it available for you. And also, have lots of availability, for your staff to see. So whether you send stuff out to them, because I know a lot of staff are working in the field, or you've got posters in the office, whatever it might be. Infographics, they're all great ways of just giving people an overview. And I think as a company, it's really, really important to. I've always I've developed as the years went on when I was managing domiciliary companies, was to do a customer service module as part of the induction, because I think that's a very, very important part of making sure that we sort of deliver a really good customer service. And I think sometimes that gets a little bit lost in trying to do the care certificate and the care certificate and everything else that you're trying to do in that short period of time within your induction periods. And I think reinforce CQC's expectations and company expectations and values, and just keep reinforcing that staff education and knowledge as you get it about the single assessment framework. And I think as a service, what you can start doing now is review your previous inspection report, dig holes in it if you want to, see if you've made the improvements that you could have made, and review the current your current service in terms of using the 34 quality statements to have a look at your service and see if you meet those quality statements. You might meet them in some areas, but not in others. And I identify areas of concern, areas that you think you could improve, just to get yourselves ready for, this assessment process. And if you do need to improve, have a proper plan, have a provider improvement plan. Just get it all in place so that you know what you're doing and your staff know what you need to work to. And I think it's really good to gain additional insights from networking with other providers, other managers. I was at the when I was at the Care Show last week, I listened to a talk from the Yorkshire Care Alliance, who are actually UK, well, England-wide, I think. I don't know if they're UK-wide, but certainly England-wide. And they were trying to develop new ways of working with clusters of providers working together. And it was a really interesting concept. So that's the Yorkshire Care Alliance, if anybody wants to take a look. It's a very much of a sort of advisory platform, and the great people there, so do have a look at that. And also I would say be really proactive in your data collection. I'm sure you're collecting data all the time about to meet the key questions, but if you're not, my advice would be have folders for each key question, and then within those folders have subfolders for each quality statement, and add your information there as often as possible. Make sure you're getting information from all your staff, your office staff, your field staff, whoever it might be. So I think being really proactive to try and get this new single assessment framework under your belt is really important. It'll hopefully take the stress out for you. So educate all of your staff. They're your best asset. They're on the front line. So just make sure they're educated about the new assessment framework. And show CQC how fantastic your service is. You know, take every opportunity to do that. Be very proactive in that. And as we've just said about the evidence collection, start now, get into the routine, and just go and thinking about getting feedback. You know, there's lots of ways you can get feedback. You know, we use, and I have used a lot in the past, Typeform, where you can do surveys with people. It's really simple platform to use for your surveys. So try Typeform. You can do focus groups, you know, whatever you want to do to get that evidence collection started now. And as I've said, being innovative with the way you get your feedback. And definitely sign up for the CQC newsletters. So if you haven't done that already, sign up for CQC newsletters and the Citizen Lab and their webinars. They're really good, and it's just good to have those emails coming into your inbox to see what's actually going on. And I think moving forward, if you haven't got a good relationship or you haven't had any relationship with CQC, really work hard on building those relationships. I think it's really, really important. I found that it's worked really well for me, even though, as I said before, I haven't really had the same inspectors all the time, but it's been really good to just be known to CQC and just have that relationship. I think it works very, very well. And you know, you can always organise a mock inspection or mock assessment. I think that would be really good as well. In terms of timeframes, having spoken to CQC last week, as I keep saying, I was never off their stand actually, so I'm sure they were sick of the sight of me. But anyway, so I think we really need to think about where we are now. So I was assured last week that the portal was working. I'm not quite sure that it is yet, so it'd be interesting, as I said before, to find what your experience have been. CQC have said that they will definitely be making an announcement of timelines for when the assessments are going to start. So they will let you know when they are going to start their assessments. And just to go back on one thing, they've also said do not just upload loads of evidence. They will ask you for the evidence that they need. And then the whole rollout of single assessment framework, who knows? I'm not quite sure. I was hoping for autumn, and I still am hoping for autumn, but it could be longer. We just don't know. So I'm just going to hand back to Marie now, and she's going to just talk about our ebook and another couple of things. And then if you've got any questions, please do stay online, and I'll do my best to answer them. Thank you.
Thank you very much, Marina. Really interesting how much more you have put together in this webinar from the one we did a couple of weeks ago, thanks to all of that research that you've been doing and bugging of CQC and others at the Care Show. So in the chat thread, I have put, thank you for that little clap, I have put a link to our next webinar, which is 22nd of June. It's our MD, Josh Huff, talking about how to choose and procure home care software without the tears and buyer's remorse. So it's really your way of getting the inside track from the people that sell software of how it's best to get the best deal, how to find the best provider for you. So I know some of you are with CareLineLive. This is not a hard sell on CareLineLive at all. It's giving you a little bit of the inside track. So that's 22nd of June. Do click on that link in the chat thread and book yourself in. You don't have to show up if you're busy that day. You'll automatically get the recording as you will today from this webinar. So our ebook, Merina wrote this all about setting up a business for success. So it's aimed both at brand new providers, but also those that have been in the business for a while that, you know, perhaps want some new ideas on how to maybe do recruitment and retention well, how to do their marketing well, all manner of aspects of running your business. It's free. You can either click on the well, the link obviously isn't going to work on the screen. It's carelinelive.com/ebook, or if you take a photo of that QR code with your phone, it should take you to that link. So let's go to the questions and answer. I don't think there's anything actually in the Q&A thread. So Merina, you don't necessarily need to look all the way back at there. We did have a couple of people early on. Luke and another person, Paul, who said that they're still not able to register on the new portal. Now, Diana gave them a link to try, so I don't know whether that will be effective for you. Merina, I don't think you've probably got much to add into that. Others, please, sorry, before you answer that, Merina, others, if you have questions for Merina, do write them up in the chat thread now so we can answer them in the next few minutes. Yeah, Merina, what have you got?
I can see that, sorry, I'm not quite sure who everybody is. I can see that somebody's saying they still can't register. I think what you've got to do is, and CQC did say this to me last week, that you just have to wait for them to notify you. I mean, what else can you do? There isn't anything else you can do, you know. If you can't register, you can't register. They have on the website put information about if you need to make an amendment to registration, or you need to make any amendments. They have put on the website of how you can do that. So through emailing and through the normal channels, I think is how they put it. So I wouldn't, from what I understand, I wouldn't worry about it too much. What else have we got? I still can't get on the portal.
So Martin is saying, how do you access notifications that was submitted using the old portal? Merina, do you want to just stop sharing your screen so we can see your face a little bit larger?
Okay, sorry. Bear with me. Stop sharing. Hello.
Lovely. So how do you access notifications that were submitted using the old portal? Do you know the answer to that?
I don't know the answer to that, but what I do know is that any information that was previously submitted on the old portal will not be lost. That will still be available, but I do not know how you access that. You know, the problem is that, you know, if you can't even register on the portal at the moment, you know, how can you even just get in there and have a look at your information? The technology isn't working properly. So, you know, I think it's probably worth emailing their inquiries line.
Okay, so the next question from Kerry. How about all the new providers awaiting their interviews who have RMs in place and will not be able to trade for months potentially? Will there be any compensation?
Well, I'd like to think so, wouldn't you? I mean, it's ridiculous. I could rant, I can tell you. It's ludicrous. It's just ludicrous. And, you know, it does put people out of business. That's the awful, unfortunate thing about it. I can't speak for CQC. I haven't ever heard about them giving anybody compensation. But I do have to say it is unfair and ridiculous. That's all I can say.
I mean, I wonder whether a little letter to your local MP might be just one way of just nudging things along. So, you know, government bodies, harassing government bodies do sometimes see some change. So that might be worth doing. Certainly CareLineLive, we write to our MP from time to time, lobbying on for different things, particularly in relation to home care. So that would be worth a look.
Can I just add something to that? You know, I did say to CQC last week that, you know, we need proper timeframes. That's part of the new framework. It's all about transparency and then working in a more agile way. So I was pressing them about making sure that they are open and transparent about timeframes. Like if you register, how long is it going to take before you get your registration?
So I can answer this, but I'm going to let you answer it, Merina. Do CareLineLive provide mock inspections?
No.
But so Merina had that link to MOA benchmarking, Moya benchmarking. If what you are looking for is more help with getting through your CQC inspection, we really would suggest you look to work with MOA benchmarking. They're not expensive at all. I think it starts at something like £100 a month. Merina has said to me many times, if I was running a home care business today, it would be one of the first pieces of software I would be subscribing to.
Yeah,
it's really
great.
Good.
It's great. Please do have a look at it. That's not a sell. We don't get anything from that. It's just it is great for what we need now, and it's specific to the new single assessment framework. So yeah.
So Stacey has said that QCS provides mock inspections. Thank you for that.
Yeah.
So that is an organisation you can obviously look to.
I've used that as well. I've used that extensively. Like it very much.
Dawn is asking, do you have any further advice as to whether care plans should be written in the first person?
Wow.
This is one of those things that comes up again and again, isn't it?
Well, CQC just said it's whatever best practice it is. That is actually what the lady said to me last week. I thought, well, grief, if you don't know. But I personally think that the person owns their care plan, that it should be written in the first person, even if they don't have capacity. But CQC, I asked them I said, if somebody doesn't have capacity, and they said you've got to go with best practice at the time.
I think if you think about it, for someone that doesn't have capacity, you need even more to be reminded that they're a person with rights and feelings and all the rest. Surely the argument is even more that it should be written in the first person than normal. So that would be my personal take on that. Paul, just tried to log into the old portal and I can't get in. Fortunately, I have all my notifications saved. Yeah.
Good. What can we say? Just going back to what Marie was saying about writing things in the first person, and if somebody hasn't got capacity, I used to always. Have you seen the poem? It's got various names. It's called. I know it as Crabbed Old Lady, or the Crabbed Lady. I don't know if anybody knows it, and I used to put it in the front of people's files. Obviously, we're digitized now, and it's about the journey of a lady to her old age, and it's all about when she was 10 and she'd be dancing, and I always thought it would gave the carers an idea, like Marie's just said, that this person has had a life before dementia. So I'll
put a link to it in the threads. There you go. So you can all see that. That's a lovely piece, Merina. Maybe we'll pop that up on our blog as well. Stacey, we are pulling our hair out trying to gain invitation to join, let alone hear back from CQC with assistance in this matter due to the delay. And if we have had an inspection in the meantime, would we be deemed as not compliant if we're not up and running on the new CQC portal?
I wouldn't imagine so. I think CQC are very aware of what's going on, and I think they take full responsibility. So that's all I can say really. The people that I spoke to last week were equally as frustrated. So I don't think I'd worry about it too much. They have to take responsibility for where they are.
I think the other thing to know is if you go to it's the resources section on our website and you look at Merina's articles, you'll find them in the section in resources that's under compliance. You will find under each of the key questions a really detailed description of what you need to be collecting in terms of evidence. If you are following all of that, you are almost all the way there. And obviously, if you're using a service like MOA benchmarking, you will be able to be collecting all of that information and benchmarking yourself at the same time. And obviously with software like CareLineLive, you've got you've got one place to put all of those records digitally. So really, when you come to inspection, it's all there.
Yeah, and I think also CQC will be asking you for the information that they haven't got. So, you know, I mean, obviously you need to be preparing, but don't worry too much, because they will highlight where they think the gaps are, and you will be giving that information. So I think, what, like I said before, is just before, like, forewarned is forearmed is forewarned, whatever the saying is. But, you know, just make sure that you're starting to collect that evidence, that you've got it in the folders, and when they ask you for something, you've just got it there just to give it to them.
So I think that probably wraps it up now. So we will be emailing you, it won't be till next week, but we will email you a recording of this. We will email you the slide deck as well. And if there are particular Q&As that have come out of this, we'll just update our little Q&A document that we have on the website as well. Thank you so much for joining us. Lovely to see some of your faces as well. Thank you, Merina, for putting all of this together. And yeah, that's lovely. Thank you for your kind comments. And we will hopefully see you all on the 22nd for our next webinar.
Take care, everybody. Thanks for coming. Bye.